Like we have a quorum, so I think we can go ahead and get started, and we may have Brad join us in just a little bit. But we should have enough people to get started. And so again, first of all, I guess I should say good morning, everybody. This is Britt Crum-Cano, the Economic Development Administrator for the city. We are going to have Eric Kirkendall, the Vice Chair, run the meeting for us today. And Eric, would you like to go ahead and get started?
I sure would. Thank you, Brett. First task is to call the roll. Patrick Kelly.
Here.
Brad Burnside. Shannon Kimball. Michelle Foles. Sorry, Michelle.
It's Michelle Fels, and I am here.
Oh, you poor thing. Rebecca Gaston.
Here.
Christina Gentry.
Here.
And Eric Kirkendall here. So we have 5 on board.
Thanks, Eric. This is Britt Crum-Cano, the Economic Development Administrator. I'm going to start by reading some special instructions for doing a virtual Zoom meeting. The meeting is being recorded and broadcast on the city's YouTube channel and public access cable channel 25. During the meeting, when you are not participating, please mute yourself by clicking on the microphone icon found on the lower left-hand side of the Zoom menu next to the video icon. When you're muted, a red line will appear over the icon. Muting your microphone during the meeting will make it easier for everyone to hear. You'll just have to remember to unmute if and when you want to speak. In some cases, I may mute or unmute people as needed to minimize distractions during the meeting. Please remember to state your name every time you speak for the benefit of those listening remotely. You can turn your video camera on or off by clicking the video icon in the menu. For the purposes of this public meeting, when you are participating in the meeting, please keep your video on. When you are not participating in the meeting, it is okay to turn your video off. You will still be able to listen to the meeting when your video is off. You'll just have to remember to turn your video back on when you are participating. Turning your video off when you are not participating will help make sure that the active meeting participants can be seen on the screen. In some cases, I may turn someone's video off if they are not actively participating to avoid distraction during the meeting. You can always turn your video back on during the meeting. If you are participating by phone, you can click *6 to unmute your phone. For those using Zoom, somewhere on your screen you will see a choice to toggle between speaker and gallery view. Speaker view shows the active speaker. Gallery view tiles all the meeting participants. Board members and city staff members, you must state your name and title each time you speak. All motions will need to be stated clearly. After a motion is made and seconded, the chair will call on board members individually to provide their vote. Mr. Vice Chair, you will then need to announce whether the motion carried and the count of the vote. When public comment is sought on an item, individuals participating via Zoom should use the raise your hand feature. Windows and Mac users can access this feature through the participants button at the bottom of their screen. Android and iPhone users can access this feature through the More button located at the bottom right corner of their screen. For those calling in by phone, you may dial *9. Individuals will be called upon by name in the order they appear on the meeting host screen. When you are called on, please unmute your listening device and state your name before speaking. The Vice Chair will then call for in-person public comment for those without access to technology options. Staff present will direct you to the podium to speak, following social distancing and safety protocols. The regular 3-minute time limit will apply. Thank you.
All right. The first agenda item is to approve the minutes. Any discussion by anybody? I would love to entertain a motion.
This is Patrick Kelly, motion to approve the minutes.
And a second?
It's Christina Gentry. I second that.
Okay. I'll vote. I will run through the list of folks for a yay or nay. Patrick Kelly?
Okay.
Michelle?
Yes.
Rebecca?
Yes.
Christina?
Yes.
And Mrs. Eric? Yes. The second agenda item is to review and provide a recommendation of the City Commission on the request from Heartland Community Health Clinic and Alcove Development T&M Properties, LLC, for industrial revenue bond financing to obtain a property tax abatement and sales tax exemption for the redevelopment of the property located at 1312 West 6th Street, Lawrence, Kansas, into the new home of Heartland Community Health Clinic. And our job today is to provide recommendations to the City Commission on waiving on this and waiving the city's IRB origination fee for the project.
Thank you.
Brett,
Thank you,
would like
Vice.
to-
Yes, thank you, Vice Chair. This is Britt Crumcano, the Economic Development Administrator for the city. If it's okay with the committee, I would like to start with a brief overview, and then we have a couple of applicants here. Dustin Baker is with the development team and the property owners, and he can talk a little bit more about the project in detail. And then we also have Robin Covington, who is the Executive Director of Heartland, and she can talk a little bit about the clinic and what they do and what they bring to the community. So to begin with, again, the City Commission is asking you to review and provide a recommendation on this request. This is going to be a redevelopment of an existing building. The clinic, Heartland Clinic, is currently in a 12,000 square foot building located at 346 Main. They have 88 employees, and they have basically ran out of room to expand further, which is why they are seeking this request. So they wish to rehab a 23,000 square foot building located at 1312 West 6th Street. This is going to be a complete renovation, and it's going to be just for the Heartland Community Health Clinic. They're going to be adding dental operatives, offices for the different healthcare providers. They'll have an on-site pharmacy, as well as being able to expand their food pantry. So the request is for an IRB sales tax exemption on construction, labor, and materials. And since it's a commercial rehab or commercial renovation, labor can be exempted as well. And then 100% IRB property tax abatement on the incremental increase in assessed value due to improvements after the renovations are completed. So the existing value, this is kind of like an NRA where the existing value is shielded from the abatement, and then also as a part of state law, we have to shield the school district capital outlay mill levy. So staff has examined the project parameters, and it feel like it can meet the majority of the city policy eligibility. I would like to point out that this is not really an economic development project. This is more of a community development project, but they're using our economic development tools. And so the fact that it doesn't meet all of the eligibility, that just keep that in mind. However, staff feels that there's enough benefits this project brings to the community that it warrants approval of the request. So since this is asking for a property tax abatement, we did have to do a benefit cost analysis. The benefit cost analysis shows that the city's preferred threshold of 1.25 can be met for all the taxing jurisdictions. So that is not a problem. The property tax abatement is estimated at a little over $1.1 million for all the different taxing jurisdictions. By state law, a property tax abatement is limited to 10 years, so they would have this for 10 years. The sales tax exemption is estimated at about $305,000, with the city foregoing approximately $70,000 of that, the county foregoing approximately $22,000, and the state foregoing approximately $212,000. Staff also recommended that a financial analysis, or but-for, it's also called gap analysis, be done. And we contract with the National Development Council, or NDC, to do that for us. They have done their analysis, and they concluded that the requested incentives are reasonable and help to avoid financing gaps that could make the project economically unfeasible and unlikely to proceed. Some final considerations before I turn this over to the applicant team. Even though this is not an economic development project, again, we stated that it does have a lot of value to the community. It provides multiple benefits. So the Heartland Community Health Clinic is the only federally qualified health center in Douglas County and surrounding counties. This federal designation means the organization has a special status. It provides distinct services. For example, Heartland provides comprehensive health services to underserved areas or populations. They also offer a sliding fee scale depending on people's income level. Another consideration is other local agencies have already benefited and receive city help just because they're in a building that is owned by the government. So those buildings are automatically property tax exempt, and they're not limited to the 10 years that this one would be. So there's a lot of other health-related organizations here in the community that already get a property tax abatement just because they are in a government-owned building. The project will be requesting an IRB property tax abatement. Again, the current property will be shielded from the abatement, so the taxing jurisdictions are at least going to get the same amount on that property that they would have received if the improvements hadn't happened. So, that's kind of a brief overview. At this time, I think I'll turn it over to Dustin Baker. He's with the Alcove Development and the T&M Property Ownership Group, and he can talk a little bit more about the project and what they're doing. And then again, we'd like to invite Robin to talk a little bit more about the clinic in case many of you are not familiar with what they do for our community.
Well, thank you, Brett. My name is Dustin Baker. I'm with Alcove Development, and I'm the owner's representative for the ownership group of T&M Properties, which is owned by Tom and Marilyn Dobsky here in town. So the project itself sits at 1312 West 6th Street, which is on the northeast corner of 6th and Michigan. And it's basically what we're doing, like Britt had mentioned, we're taking a 23,000 square foot building that used to be the home of Anderson Rentals, and we are completely renovating the building. What is going to be left from the existing building is the slab floors and the existing walls, but everything else in the building will be pretty much brand new. New roof, new electrical, new plumbing. We're even going in and saw cutting all the plumbing lines out of the existing floor and updating the plumbing throughout the building. And this project, we're the ownership group, the development team, we're super excited to be putting this project together for Heartland Community Health Clinic. We feel like they provide a substantial need in the community, and we're so grateful to be a part of it. And I'm more than willing to answer any questions that the committee has of me, but right now I'll turn it over to Robin.
Hi, thank you all so much for your time. This is Robin Covington, the Chief Executive Officer of Heartland Community Health Center. And when we first approached the city about opportunities that may exist that would help us, it was really coming from a place of true need. Heartland Community Health Center is the sole safety net clinic within Douglas County and really serving our surrounding counties, our closest safety net clinics. And when I say safety net, what I mean is a clinic that will accept anyone who walks through their doors, regardless of whether they have insurance or not, and provide those services to them on a sliding fee scale in kind of an outpatient setting. The closest are in Topeka and in Johnson County. So there is a wide swath of individuals who simply don't have access to care. Approximately 70% of our patient population actually lives in Lawrence. That's going to change slightly with the acquisition of Douglas County Dental Clinic and their dental outreach program, which goes into surrounding counties like Jefferson County and Jackson County, and so on and so forth, Leavenworth County. But the bulk of those who are being served in a non-dental outreach program is about 70%. And there's a very significant portion of patients who simply don't have the ability to pay, which means they are either underinsured, meaning they have such a high deductible that they might as well not have insurance, or they are uninsured, meaning that they're going to qualify for our sliding fee scale. And as you all know, healthcare is expensive. And given the large proportion of uninsured patients that we see, when I have a patient paying, $25, $35, $40 for a visit, that simply isn't a break even. It's absolutely the right thing to do for our community, and we are happy to do that. But anytime we're able to find ways that can help offset some of that burden that we have in providing that care that is that our federal grant, while very nice at around $2 million a year roughly, that is basically a drop in the bucket. It doesn't even begin to cover the full need. So what I would say is, we do provide comprehensive services. We provide them to anybody who needs them. And that's talking oral health, dental, behavioral health, psychiatry, and primary care. And I'm happy to talk a little bit more about Heartland or what we do, but just really wanted to express my appreciation for the consideration and see what I could answer that would help you as you look to make determinations on whether or not this is feasible.
This is Eric Kirkendall, Vice Chair. I do have a question. I'm really happy to support Heartland. I think it's really important and a good use of tax dollars. But I do have a question. Is there any guarantee that Heartland will be in this building for the full 10-year term of the IRB, or is there any provision made in the event that Heartland relocates during that time period?
Well, that one is an easy one. I love it when I get easy questions. So we have signed a 20-year lease on this building with 2 5-year options to renew. So our plan is to be in this for all eternity. This is going to be the hub. Now, as needs progress, we may have satellites, but we absolutely we're in this for the long haul. It's perfectly located. It is it's going to really serve a need, but we absolutely can be in there for that full 10 years.
Also, Vice Chair, this is Britt Crumkano, Economic Development Administrator with the city. In our IRB documents, we will have provisions that the incentives are tied to Heartland continuing to use the building and be the tenant. So we've already been discussing that with our bond counsel, and so we will have all those in place as well.
Thank you, Brett. Any more questions by committee members?
Hi, this is Christina Gentry. I totally support this project. A community development project is wonderful. I know that you are located easily off of public transport. So I know there's a few buses that are on that route. People can easily get back and forth. I also understand it's operating as one of the current COVID testing sites. Is that correct?
Yes, starting this year on March 16th, we set up exterior screening for COVID and have been doing COVID testing since March 16th, and we have not taken that down yet, and we are still keeping that separate from the clinic to protect staff and our patients and the community at large.
Yeah, thank you. I just had one question. Could you tell me a little bit about the outdoor pharmacy? I think I heard that. Maybe that's a question for Dustin, but that was something. Yeah, that was something that I heard and I picked up. I'm sorry. I'll mute now. But yeah, the outdoor pharmacy.
My apologies. This is Robin Covington with Heartland again, and it is a drive-through pharmacy. It is a 340B pharmacy. So what that will do will provide access to our patients at for prescription medications at a significantly reduced cost. Those are typically about 60 to 80% off of retail cost. And so when you're looking at inhalers is a perfect example. You know, those can cost, upwards of $250. You can get an inhaler on a 340B price for about 80% of that cost. And so we are really excited to offer that. It is a unique program that not everyone has access to, but as a federally qualified health center, we do have access to 340B pharmacy. And so trying to make that available, not just to our patients, but to the community as well. Now 340B is only available to our patients, but to make a full retail pharmacy available to all, we thought was important as we continue to provide services.
Any more questions of the applicants or Britt concerning her evaluation?
Vice Chair, this is Patrick Kelly, Douglas County Commission. Britt, can you talk just a little bit on 3.5 and 3.51A talks about wages, and I'm sensing some support here for this and just want to hear the city's response and their recommendation and how that lines up with 3.5.1A regarding average wage.
Yes, I'll be happy to do that. This is Britt Krumkano, Economic Development Administrator. The average annual wage, you're saying 3.51A, is that correct?
Yeah, maybe I'm reading it wrong, but it says for each employee employed on the premises, they must pay an average wage to that employee for his or her employment category. And there's no answer on that question on the recommendation, and just wondered.
Correct.
Maybe I'm misinterpreting that. That's highly possible.
No, that was because we did not have the information on there to say yay or nay to whether it met eligibility regarding that. I did send a the 2020 wage survey for Lawrence has just been released. I did send that to Robin. It is a big spreadsheet, and to go through and figure out whether her employees actually meet or don't meet that would be a pretty daunting task. So I did not hear back from Robin, and I, as staff, could not put anything down as to whether that did or did not meet that eligibility.
This is Robin, Commissioner Kelly with Heartland. Bridge is right. I was not able to get that information back. It was a pretty informative and very detailed spreadsheet, which is quite helpful. But what I can say is that, in looking at it, at least taking that initial glance, knowing that the lowest salary that we pay to anyone within our organization is $14 an hour, and that we use salary data that we get from the Primary Care Association of Kansas, Community Care Network of Kansas is what that is, and that we track that and we try and pay somewhere around the median for our positions. I don't think that there would be any concern that I have about us meeting that average wage threshold, but in full transparency, I did not have that information back to Britt in time.
Thanks. Robin, can you talk a little bit about wages in your industry? I think it would be somewhat dependent upon, reimbursements and then, passing on those costs onto the consumer would seem to be a barrier to you providing the services you provide. Is my thinking around that correct, or am I missing something?
Well, we're really not, this is Robin again, sorry. We are really not tied so much on our salary to reimbursements, as much as that, might be a nice school of thought to take. It just simply isn't one that allows me to go out and recruit and retain, given the lower average reimbursement that I have based on my payer mix where it exists currently with the high number of uninsured. So what we have to do is we have to do everything we can to compete with private practice, to compete with other healthcare providers within the area. And so we have to pay a relatively competitive wage. Now, we are fortunate in that a lot of people who work for us, they work for us because of the mission. They work for us because they want that do-good feeling, which thank goodness for that, because I will tell you, I'm not ever going to be at the top of a pay scale where I can compete with private practice, but I can pay a competitive wage at least.
Thanks for setting me right on that. Appreciate it.
This is Eric, Vice Chair. Any more comments, questions?
Hi, this is Member Gaston, board member. I do have a couple of questions. I think first for Robin, can you talk a little bit about your overall budget? Like, I know a lot of it, or a good chunk of it comes from the federal government as an FQHC. Do you also get support from city and county government?
We get,
Go ahead.
This is Robin. Yes, we do receive some level of support from both the city under the special alcohol tax that pays for a provider in one of the areas specifically dealing with SUD or substance use disorder. And then we do get funding from the county to pay for some of our behavioral health initiatives and the care teams associated with behavioral health. All in all, that comprises probably easily less than 5% of our budget.
Thank you. I saw a story, I think, did you recently merge with Panda Pediatrics?
We will be on January 1st. Mm-hmm. They will be coming into the FQHC umbrella under Heartland.
But you'll still have those two separate sites? Okay.
Yes.
I think actually one more question for you, Robin. I appreciate that you start people at $14 an hour. That's a sustainable wage, I think, in Lawrence or close. Can you speak to like how many of your employees makes over $100,000 a year?
I could pull that data. I would say that our average salary is probably right around $56,000-$60,000. I think the positions that are going to be over 100,000 are typically going to be your providers. So your advanced practice practitioners, your physicians, your primary care providers. A few administrative folks, but for the bulk of it, I would say it's the providers.
Thank you. I think my next question's for Dustin. I wanted to ask about how long is it T&M Properties, how long have they owned the building?
They purchased the building roughly in 2017.
Okay. What did they pay for the building at that time? I was trying to look on my phone for county records, but I can't.
1.5 million.
How much?
1.5.
Okay. And you may or may not know this, the $25,000 a month plus the property taxes, is that typical for what this rental market would bring?
Yeah, it actually equates to about $17.65 a square foot. And for medical practice, that's That's probably a little bit below average, honestly, in this market. And how we structured the lease and the construction cost. So Heartland is going to get the benefit of any cost reduction in the construction cost. And that's how we've kind of factored it into the lease arrangement. So once we get the final bids and we come up with the final cost determination, we sit back down with Robin, and our goal is to get that $25,000 down, not up. So that's kind of why we structured it the way we structured it.
Thank you. I think that's all my questions. And I should have started by saying I'm excited about this project too, and such an important service for our community. Thank you. That's all my questions.
This is Eric, Vice Chair. Any more questions? Would somebody like to make a motion?
Eric, sorry, this is Patrick Kelly. Sorry to interrupt. Do we need to take public comment before we make a motion here?
Thank you, Patrick. Are there any members of the public who would like to comment?
Chair Diane Stoddard, Assistant City Manager. I do not see anyone on the call here with their hand raised, and unless Britt has anybody in the room, we don't have any public to comment.
This is Britt Crumkano. We don't have anybody in the room for public comment.
Thank you, Diane and Britt. The floor is open for motions.
This is Rebecca Gaston. I will move that we, let me pull up the language. That we approve the request for IRB bond financing. And I think what I'm hoping to do is to do this as two separate motions, to do the property tax abatement separate from the sales tax exemption. And so I would like to move just on the sales tax exemption at this point.
And a second?
Second. This is Patrick Kelly.
All right. This is Eric Kirkendall, Vice Chair, and I'll call the roll. Patrick Kelly?
Yay.
I assume Brad Burnside is still not online, or Shannon Kimball. Then I'll move to Michelle Sales.
I'm a yes.
Rebecca Gaston?
Yes.
Christina Gentry?
Yes, I approve.
And this is Eric Kirkendall, Vice Chair. I approve. So the motion to approve the request for sales tax exemption has passed unanimously. Would somebody like to make an exemption on the IRB portion of their request?
And Mr. Chair, Diane Stoddard, Assistant City Manager, included in that motion, if you would consider it, is the as a recommendation on waiving the industrial revenue bond origination fee.
Perfect. Thank you so much. So we're looking for a motion to regarding the IRB financing request and the request to waive the city's IRB origination fee. In the absence of anybody else wanting to do it, I will make a motion that we approve the applicant's request for IRB financing and for waiving the city's IRB origination fee. Do I hear a second? This is Eric Kirkendall.
excuse me, Mr. Chair, Diane Stoddard, Assistant City Manager, if you could include in that motion the specific wording about the property tax abatement, that would be helpful.
Okay, I'll read from the agenda item so I get it right. Thank you so much. I move that we make a recommendation to the City Commission on the request from Heartland Community Health Clinic and Alcove Development /TNM Properties LLC for industrial revenue bond financing to obtain a property tax abatement for the redevelopment of the property located at 1312 West 6th Street, Lawrence, Kansas, into the new home of Heartland Community Center, and that we recommend approval by the City Commission of the applicant's request to waive the city's IRB origination fee for the project. Do I hear a second?
Well done, Mr. Vice Chair. This is Patrick Kelly. I'll second.
And with a second by Patrick Kelly, thank you so much. I'll take the roll on that motion. Patrick Kelly?
Actually,
Yeah.
sorry, I wanted to see if there was time for discussion. This is Rebecca Gaston. I'm sorry.
Absolutely. No, you shouldn't apologize. I should have offered. Let's have some discussion.
Just one quick question, clarifying question. So the property tax abatement is just for the increase in value of the property. Okay, correct. Thank you.
Any more discussion? I will. I'll throw out something then, just maybe to get the ball rolling. I view my role. This is Eric Kirkendall. I view my role on the PERC as looking out for the taxpayer, and I can't think of a more deserving project. This will help keep healthcare costs down for the most needy people in the city who can't otherwise afford healthcare, and that's incredibly important, especially in these times. Any more discussion, comments, thoughts? Okay. I will, I'll return to, let's read the roll and take a vote on that motion, starting with Patrick Kelly.
Yay.
I'll read their names, so I think they're probably not on. Brad Burnside, Channing Kimball, Michelle Fales,
I'm a yes.
Rebecca Gaston,
Yes.
Christina Gentry,
It's a yes for me too.
and this is Eric Kirkendall, Vice Chair, voting yes. With that, it is passed unanimously. With that, I believe we have concluded our agenda items for today. Unless there is more to discuss, I suggest that we adjourn.
Vice Chair, I think we need to call for, I think you need to call for, this. Excuse me, this is Britt Crumcano. I think you need to call for just general public comment on things that weren't on the agenda.
Thank you. Do we have any general public comment?
I'm not seeing anybody, there's nobody in the room here who would like to make general public comment. And it looks to me like there's nobody on the participants list either that has indicated they'd like to make public comment.
Okay. Thank you all for putting up with my first attempt to run one of these meetings. I move that we adjourn. Everybody okay with that?
Actually, can I ask one more question just to throw everything off again? This is Rebecca Gaston. It seems like at this time of year we've done budget reviews. Are we due for that, or it's pretty late in the year, so maybe we're not. I know COVID threw everything off, so I wanted to about that, and then I have one more question after that.
This is Britt Crumcano with the city. This year, because of COVID, the city manager, rather than doing outside agency applications and having them come to you for review, he chose to fund the agencies at their 2020 amounts and basically just treat them as a vendor where we will have a contract with them. So you will not be reviewing the 2021 request for the Economic Development Advisory economic development outside agencies.
Okay, thank you. I guess one quick sub follow-up to that, and then I do have another question. For the FY22 budget, will we be reviewing that probably next summer, or?
I think the plan is yes, but we're going to try to tie outcomes more closely to the strategic plans and the outcomes there. So that'll take a little bit of doing to see, what our outcomes will be and our performance measures. Diane, do you want to jump on and explain even further?
Diane Stoddard, Assistant City Manager. I think with these particular vendors, our plan is that they will be more partners and their work will be tying directly into the economic development strategic plan work and the city plan work that the city has anyway. And as to how the county handles, their funding, that's maybe a different topic. So I think it's yet to be determined exactly how those requests for funding might be reviewed. We're a little bit new in transitioning to, what we're doing in 2021 at this point. So hopefully that at least answers what we can answer at this point.
Yeah, that's helpful. And I think part of why I was looking forward to the budget review, or if I'm calling it the right thing, I remember last year, I think the BTBC had talked about they were working on a childcare center, and I don't know if that got anywhere. I'm sure COVID slowed it down like everything else, but I was really interested in learning more about that, and I can do that on my own time too. But I do want to have maybe talk to the group here about, what we might be able to do to encourage childcare be considered the economic development driver that it is, because it's so critical for all business that we have high quality early education opportunities in Lawrence. And so, would really love for PERC and the city commission to be thinking about that. And so I just wondered if you all had ideas about ways we could maybe put that on an agenda for a future meeting, or otherwise communicate that to potential applicants that we want to see that as part of their requests.
Diane Stoddard, Assistant City Manager. I think your comment, Rebecca, is really timely. We have actually an agenda item on the agenda for the commission meeting this evening, where the commission is going to be hearing from our consultant, Ernst & Young, related to the Economic Development Strategic Plan. And they had a lot of interesting recommendations and observations in their report that they'll be providing. So I'd encourage you to take a look at that online. And then if you want to hop on tonight or view the meeting, you're welcome to do that too. But one of those items does talk about childcare. So, definitely recognizing that as a really important thing for employees to be able to depend on, to be able to get to work, and employers to be able to depend on as well. So making that connection.
Okay, thank you. I'm done. Thank you, everyone.
Great comments, Rebecca. Should anybody else like to have any discussion, any comments? Barring that, Britt, are we in a position where we need to be scheduling our next meeting?
This is Britt Crumkano with the City of Lawrence. Vice Chair, these PERC meetings are typically scheduled on an as-needed basis, which means as projects come out. So we don't have a set meeting schedule. The only reason we could kind of take a poll last time was because I knew this item was getting ready to come forward. And at this point, I don't anticipate another item coming forward.
Okay, thank you. Are you all ready to adjourn? Okay, this is Eric Kirkendall, Vice Chair, adjourning the meeting. Thank you so much to everybody.
Thank you.
Thank you.